Doctor consultation for my TTs, my tetas, and the wait was kind of like a little bit longer than I thought, but once he got in there, he got down to business, and I like got filled up. I practically flashed the whole Beverly Hills with where the building is. You can see across. Currently in the waiting room, actually in the thingy, got boat control. I think I just flashed the whole neighborhood. And where I do all my checkup and what size is needed, and what size recommended. So we're gonna go around about 295, and 295 kind of skip up to like 310. So we're gonna do a body scan on my next consultation before I do my surgery, which I booked it for in the coming months. So we're getting my boobs a little bit more early than we thought. So excited. I thought it was gonna be like 4 to 6 months, but then she said, oh, it's a quick surgery, so she can just squeeze me in anytime as soon as possible. And the earliest was like June 7th. So just a week before our anniversary. So by a 3-year anniversary, you get to feel some new titties. Are you excited? That's your 3 years anniversary present. What's your present to me?
Seems like it's your present to you.
No, you get to squeeze it. So now we're just gonna go to stop with all my medicine, with the vitamins before my surgery, because it's gonna be in like just a bit over a month. So. Today is Monday, so we're gonna go in to get blood tests, COVID tests, because you're supposed to do all that test before your surgery. And they kind of moved up my surgery really early, so I have like last minute to do everything. So I have to do everything today, and hopefully the test get done by Thursday before surgery. Today is testing. Tomorrow we're gonna do a pre-op, so I'm gonna try to record as much as possible there in the doctor's office also. And I think the team is also recording for their YouTube and social media also. And it's sad that Audrey can't be in the office for pre-op because of COVID, so I have to record everything alone while I'm getting filled up. And tomorrow we're actually gonna get to pick what size we're gonna go with. I have some idea what size I want for my implants, but we have to see tomorrow. We're gonna have to get to like feel it and then do some 3D imaging, some stuff like that. So yeah, and then Wednesday we got a day of break. We're supposed to get a COVID vaccine Wednesday, but I'm gonna reschedule it because I don't want to get a fever the day of surgery, just in case. And then Thursday we got surgery, and then Thursday morning we're gonna get up really early for a close-up checkup. So yeah, so that's gonna be our schedule this week. This is some really small elevator.
Nereden premium schedule there.
Huh?
Let's reschedule the thing when we get home.
Yeah, he asked, and I asked him, and he said should reschedule it. So we just finished with the KEG testing, all the tests I need for before the surgery, including the COVID test. So we went there. So I'm gonna list the doctor that I went to for the testing today. It's Dr. Ashkan Ghavami. He in Beverly Hills. We're in like Rodeo Drive right now, and it's actually kind of busy. It was an interesting experience. He was super nice. The whole process was kind of quick. So I had to go in and get all the blood work, the PTT, whatever blood work that I have to get done, and then one of the interesting tests that I have to get done, it was the EKG, and I never got that done before. So what that does, I have to like take off my top and everything, and some part of my legs. So they kind of like hooked up all this like adhesive thingy into your body, like on your calves, on your arm, on your like chest and stuff like that, to I guess to measure the body electricity or your heart rate or something like that for surgery, because you're gonna go under, so you just want to check your body electricity with the EKG machine, something like that. So yeah, so it's all like laying there all hooked up to all this wire, and the EKG was actually really quick. It took longer to like hook up the wire than actually doing the test. The test was like 30 seconds, and the hooking up the wire was like 5-10 minutes. Yeah, and then had to give blood, and then he did another COVID test. So with Dr. Ghavami test, I had to get tests either 5 days or 3 to 5 days within the surgery date. So I have to take another one last Friday for the pre-op, because it's like 2 days apart. So I had to like take two different COVID tests and all that. Whew. We just finished another day. I have to take the COVID test before the surgery, before the pre-op actually. So yeah, so that was all my tests today. So hopefully he's gonna send everything to the lab for expedite testing something, because my surgery is on Thursday and today is Monday. Yeah. So hopefully he clear everything, and then we'll be done with that surgery. And then I asked him about, we was concerning getting a COVID test, because our COVID vaccine is on Wednesday. Our second dose is on Wednesday. I'd asked him, like, should I get it or should I wait? He said I should wait, because you get a chance to getting like recovering from the vaccine. Either you're gonna get like a fever, your arm gonna be sore. You don't want to deal with all of that on like the day after with the surgery. You don't want to show up on the day with the surgery potentially getting like having a fever and getting your surgery canceled. So he recommends reschedule it for like next week, because it's kind of easy to reschedule it these days. So one day done. Now tomorrow we have to wake up early again. So tomorrow we have to wake up early again for pre-op. So tomorrow gonna be another interesting day, and Andre can't wait with me in the office tomorrow. Earlier doing the zombie. Now we just kind of decide on the size. Now we're just gonna wait for me to take pictures, and then we'll be done. We just finished with the consultation, so now we're just gonna go ahead and meet Andre for lunch. So we ready for Thursday. finished for the day and I can't wait to get home. We just stopped by the CVS to grab my prescription. So you get your prescription 2 days before the surgery and you have to bring the prescription into the office the day of surgery. I'm not sure why. But I'm checking to show you what prescription. But you have to bring it in for the day of the surgery. Get more things to carry. But yeah. We've been wearing masks for like the past 4 hours. I can't wait to get home. Finally tomorrow we get a day of rest and then it's surgery day. Finally home from a long day. I think we've been have to stay home for so long that we're like getting tired of like going outside or going anywhere. We just want to be staying home. So long day. Phone, wallet. We are currently heading into the surgical place. Surgery day. So now we're just heading to the surgery place. Right now it's like 9 in the morning. So it's gonna be kind of early. So today we have to go in without any makeup, any moisturizer, no lotion, no potion, no deodorant, no nothing. And I'm kind of like dehydrated. So I have to stop drinking any liquid, any water after midnight, and my surgery time is not until 10. No, I have to be there at 10, so surgery is at 11. And it's 9 right now, so I still have a few more hours. Not allowed to drink anything, but when I get there, they're gonna put in an IV and an extra an extra IV thingy that you put in with all the nutrition vitamins. IV, something like might as well shove it in me with the IV drip while I do my surgery, so the recovery gonna be slightly better. So yeah. So this surgery day is actually a little bit more later than my last surgery, which is nice. Last time we went was still dark outside. Surgery. So today we have to bring a prescription for the nurse to tell me what to take. Something like that. So and like I told you to bring an extra throat just in case you're cold. That's it. Just looming. Been to Rodeo Drive so many times. Been here like 3-4 times already this month. Yeah. And today I'm gonna come home with 2 brand new bags from Rodeo Drive.
It's my joke.
Yeah.
You took my joke. Nice to have a place like this.
So thirsty, so hungry. Sex. Is it open?
I don't see it's open at all.
Did they close? Some Andre dropped me outside, and now he can't go up to the surgical place.
out one here, and then this one's gonna stay out. So it'll be like a little toga, and then you go ahead and turn around for me. I know, right? It's just for the IV. So when we get into the operating room, this comes off anyways. And now everything else, you can just leave it in this bag. You don't have to put this on yet. We'll wait for that. You can do your betadine wash, and then this is just a blanket. And then I'll come in a little bit. I'll take some videos of you, okay? I'm excited for you. It looks so good. I'm excited.
Me too. Freaking out.
You got this. This is nothing. This is like the easiest. Yeah, okay, I'll be back in a second.
Now we have to mix this betadine and then mouthwash together.
Yes. So we'll put this on first before you turn around for the camera seat. 3, 2, 1.
Okay, so we have a young transgender patient here who I'll give you a little background on her hormone therapy and how that's been going because it is relevant to what we're doing today. We're doing a flash recovery breast aug.
Alright, awesome. Ready? 3, 2, 1.
So by any standards, I would say she's a small A or double A cup. And according to her, she went 7 years on regular hormone therapy and in the past few months has gone on shot therapy. And with the shots, she says she's seen double size and softness. So that always helps a plastic surgeon because the suppleness of the tissue is what allows me to allow the capsule to not be hard and for the breast implant to settle and the pocket and everything to have a nice home. So you can see somewhat of an inframammary crease here that's forming. So I'm going to mark her natural crease. And this tissue here, as far as I'm concerned, is very female, which means that it has suppleness to it and it has softness to it. So the hormone therapy definitely does assist what I'm going to be doing. Now I'm going to lower the crease a little bit. You can see this 1 centimeter lowering. It's important to do. And I'm also going to expand some of the internal tissue here to allow this to be natural teardrop. She naturally has a little bit of a lower, less defined crease on this side. So you can see if I drew a line, this crease is lower than this one. So I'm gonna have to do some manipulation. We can't really lift this crease up. We can kind of do that later after the implants have been there for a few years. But today we're gonna lower this crease down. So I'm gonna judge that in the operating room, what the amount of safe lowering is. We never try to achieve perfect symmetry in the human body, but we certainly don't want to make the human body more asymmetric if we can avoid it.
Great.
Okay. A lot of roadmap drawing. So I want you to see that too in the mirror. It's kind of cool for you to see. Let's talk about the muscle release. Ready?
3, 2, 1.
So in all patients, my preference is to go under the muscle, and what we're going to do is a dual plane, which means the part below here, where these lines are, is going to be not under the muscle, and above, about right here, will be above muscle, okay? So if you look, this is where we stop releasing that pectoralis major. Beyond here, if we over-release, you can get window shading and lots of weird animation problems where the skin pulls in a certain direction. We're gonna avoid all that and just stop the release about right here. So this is called a dual plane 1 to 2 dissection technique.
Awesome.
I went extra technical in case you want to use it. Any questions for me?
No.
Okay, and we'll talk about volume. We're in there, and then Dr. Pandya is going to come put your IV in. So just put both in. They'll take one of them out.
Pick 'em
Got
in.
Hotmail? Got it. Okay, I'll send it to
Pick
you.
'em in.
Yeah, come on in.
Okay, how's it going?
I'm good.
Dr. Pandya, I'm your anesthesiologist, alright? Excited?
Yeah.
You live in LA? Yeah? Nice. Just gonna pull your arm. Pull your arm through. You don't even need a tourniquet.
Huh?
You don't even need a tourniquet. room is set up, so basically we put the IV in and then probably gonna go. Okay?
So
Alright.
my favorite part.
Favorite part? Look at that. Look at her veins. Amazing. Using a lot of small baby needles. One, two, three. Can you cough for me? Cough, cough, cough. Alright, all done.
Do hormone shots every 2 weeks and I hate it.
Where do you have to put it in your stomach or butt?
On my thigh.
Every 2 weeks?
Yeah. And I only do it myself. So
Oh,
I hate it.
Oh, I think that's harder.
Yeah, it's
Honestly, like when you have to do something, like
the
hold yourself.
anticipation of
Yeah.
like you have your shoe just
I
like the needle.
think that's a lot harder than someone else doing it. I've had to give myself an IV once, like stick it, and not fun.
Hi, how are you? I'm Diana, I'll be your nurse. I'm just gonna grab all this stuff. Who's taking you home?
My husband.
Okay, perfect. You put his number?
Yes.
Is this you?
Yes.
Hi.
And she turned it off. And even put it back.
Okay, bye.
Okay, obviously this implant is in, the left one is not. We did a bloodless pocket dissection, submuscular, dual plane 1 to 2, which means partially submuscular, that's the way it goes. She's gonna have beautiful side boob, under move as time goes by, and look how the crease is respected. Exactly my markings is where my pocket ended. That's how it should be, precise, bloodless.
Of course, tomorrow when you come for your post-op, you will talk to the doctor about it. And then abdominal, I just know that the legs don't have too much support. That's the only issue with that. So I'm not sure. But you can go ahead and ask tomorrow. Hi.
I got titties.
Here, let me grab that for you. There you go. And I'm gonna help you into the car, okay? Alright, and make sure you watch your head. Alright, let me help you get your seatbelt on. Alright, I'm gonna put this behind you though, okay?
Thank you.
Alright, you're all set. We'll see you guys tomorrow.
Yeah. For tomorrow, do I go to the 7th floor?
7th floor, yes, yes. Mm-hmm.
They did not call me an hour before. They did not call me an hour before.
So I just finished with the surgery. I just woke up, I think like about 5 minutes ago. My mouth is actually dry from the mouthwash and the whatever they mix in with it.
Are you hydrated from the IV?
I think I'm hydrated. My mouth is just dry because before I have to do the mouthwash and then the antibiotics, whatever they rub in your body, it's like mixed together, so it's made chest right now feeling like it's like tender, it's like hurt a little bit, and the pressure. I totally forgot I was in surgery. I woke up and I totally forgot I was in surgery. I was having a dream I was going shopping.
See, tell me you're gonna have a nice sleep. Why?
It's nice.
Wonder.
You went
why I'm
shopping? I mean nice things.
No, but I got myself a t-shirt.
So rude. Huh? The audacity. From where?
Banana Republic.
Ugh. So you guys, I got titties.
Don't flash them.
Bam, bam. My chest feel like really tight right now because of the implants. I can feel like the stretch. And each time I kind of like breathe, I can feel like the pressure and the tender. And I'm trying not to breathe so hard.
Trying to do it.
I'm trying not to breathe so hard because each time I breathe, it's like press against it. So I feel like I have somebody sit on my chest. Not my chin. Gynecologist was super nice. It's kind of cute. All the girls on the nurse was super nice, and I think we did a recording and all of this. So I think she's gonna try to send me the footage. Put in the IV, walk over to the surgery room, hook up to all these machines, put this mask thingy on me, and when do you want to go on vacation? And I wanna go Greece, and like next thing I woke up, I thought I was going shopping, and like, what the fuck am I doing in this room? And I looked down, I'm like, ooh, titties. So yeah, so we just left Beverly Hills with 2 new bags. They're pretty good, decent size. I was afraid the size we picked would be a little bit more bigger. I'm gonna tell you guys the size on like the next coming video when I answer all the questions and all the stuff. And I think the anesthesiologist and the nurse have me on Instagram. I woke up and be like, oh yes, you got 2 new friends. So if you haven't followed me on bellasnow. If you like this video so far, don't forget to like, subscribe, down below, ring the bell button for the next video.
It's preventing them from coming as close as they're going to come in the future because it's like really stiff, like a swollen ankle sprain. You can gently with the finger kind of go down like this. Yeah, just gently. Take your time and then watch when I dip my finger.